everyone, welcome to our channel. Today we're talking all things PCOS and fertility, what you need to know. By the end of this video, you will know how to manage your PCOS and improve your fertility symptoms. So make sure to watch exactly everything through. I'm here with Dr. Basma, our PCOS expert. She will be sharing a lot of great resources and insights into how we can manage our PCOS as well as improve our fertility. So if you're looking to conceive or struggling to conceive and you have PCOS, this video is definitely for you. Dr. Basma is a board-certified OB-GYN. She is a PCOS specialist with over 20 years of experience in the healthcare industry. She is a certified culinary medicine specialist as well as a former registered dietitian. So without a doubt, we're going to learn so much from you today. Please walk us through a little bit of how you even started in the PCOS space in the first place. So you were a former registered dietitian. What led you to be here today?
So yes, thank you so much, Alicia. As you mentioned, I started my career as a registered dietitian. So certainly just in my practice, I would see people, adults, children, men, women. Amongst that, certainly were a number of women who had polycystic ovarian syndrome. So that was really sort of my first introduction to caring for people with PCOS. And I saw really early on that connection, right? Because I was seeing people from that perspective of wanting to make nutritional changes because of their health problems. And as I transitioned from being a dietitian to being a physician, I really just started to see it more. And so I really thought, well, there really is something here that I think a lot of people are missing, that connection between metabolic health and the impact of nutrition on the menstrual cycle in people with polycystic ovarian syndrome. And so that's really where I became interested in it, because it was honestly, PCOS is probably the place where I get to use sort of all the different parts of my brain to help, people with this one particular condition. So I was just sort of naturally drawn to being interested in this topic and have just been sort of obsessed with it ever since.
Growing up, being sometimes in and out of doctor's offices or even just being in high school, I don't think in healthcare class or just in general in schools, they teach us the balance of like how nutrition affects our menstrual cycles. So undoubtedly, I think this is going to be very interesting to discuss how it also affects fertility. I want to start off with just kind of explaining the basics. So what even is PCOS in simple terms?
So PCOS, which stands for polycystic ovarian syndrome, is a hormonal and metabolic condition that affects people's menstrual cycle or their ovulatory cycle and also their metabolic health, in that the majority of people with polycystic ovarian syndrome have both some challenges in having regular ovulation and therefore regular menstrual cycles or ovulatory cycles, and also a degree of insulin resistance. And there's an interplay between these two systems, the metabolic system and the reproductive endocrine system, and they interact with each other. And so that's where we see this overlap. People with polycystic ovarian syndrome have many, many different symptoms beyond their menstrual cycle dysfunction. They have can struggle with fatigue and challenges with weight gain and mood disorders, and all of these things actually are, and some skin disorders, right? Like acne and facial hair or hair loss on the head. And both of these sort of are a result of the interplay of these two systems. It's important to understand them both. Today, we're going to focus a little bit more on the menstrual cycle and the ovulatory cycle as we talk about how it pertains to fertility. But just at the basic, the sort of what PCOS is, it really is sort of the interplay of these two systems.
One thing that I was curious to know is that, of course, not everyone with polycystic ovarian syndrome have those enlarged follicles in the ovaries, but for the women that do, how does that affect their menstrual cycle and their fertility?
So the term polycystic ovarian syndrome, as you know, comes from the appearance on ultrasound of multiple small follicles that are lined up around the periphery of the ovary, right? And really what this is representing is that there's a large number of follicles that are sort of recruited, right, to be potential eggs that ovulate. But because of this disruption in the signals the follicle doesn't rupture. And so they line up around the ovary, okay? Mm-hmm. And so we think about the menstrual cycle, I think, in the wrong way. People think about the menstrual cycle with the menstrual period, the bleeding, as the sentinel event, right? As the important event. And it makes sense because that's what's visible, right? That's what we see.
Right.
But actually, the most important event in the cycle is ovulation. And that is what doesn't always happen on time in people with polycystic ovarian syndrome. Either it doesn't happen at all or it happens later than what we consider average or normal.
Of course, learning more from you, I'm starting to realize that it's the ovulation that's more of that window that shows us our health, and it's a good marker of good health. So how can we distinguish menstruation and ovulation? Ovulation, I assume, of course, comes first. Are there different signs to both?
Correct. So in a normal menstrual cycle, which is on average 21 to 35 days in length, somewhere in the middle of that is the event, which is ovulation, where the egg is released. And after that happens, the ovary undergoes a switch. So in the first half of the menstrual cycle leading up to ovulation, the ovary produces more estrogen. Testosterone is converted into estrogen by the ovary. And then after ovulation, the ovary switches and it still makes some estrogen, but now it's also making progesterone in preparation for a pregnancy. And if a pregnancy doesn't occur, then both the estrogen and the progesterone fall, and that results in a bleed or a menstrual period. Now, some people have bleeding, semi-regular bleeding, but they don't have ovulation. Okay, so just because somebody has a bleed, a quote unquote period, doesn't mean that they necessarily ovulated. So how do you know, right? There are some signs that our body tells us that can indicate that we're about to ovulate or that we ovulated. And now we have some more sophisticated tests that we can use to confirm that. Let's go through what some of those are. One of the oldest ways that people try to predict their ovulation is by looking at changes in their cervical mucus. So cervical mucus is mucus that's produced by the cervix that changes in its consistency throughout the cycle. It gets closer to ovulation, the consistency changes. And when you have what's called fertile cervical mucus, it looks like an egg white. So you know how the white of an egg, like a chicken egg, is sort of clear, but also stringy, stretchy?
Yeah.
That's what this cervical mucus that occurs prior to ovulation looks and feels like. And the reason for that is when it's clear and stretchy, I like to call it like the sperm superhighway, so that if somebody is trying to get pregnant, it allows the sperm to penetrate and allows for pregnancy. After ovulation, the cervical mucus changes, just a thicker consistency.
Yeah.
Instead of that, it's no longer stretchy. So when people notice a change in the consistency and the color and the quality of their cervical mucus somewhere in the middle of their cycle, that is often one of the signs of ovulation. Another thing that people don't often realize is that there's a change in our body temperature before and after ovulation. And so our body temperature, what we call our basal body temperature, which is sort of like our baseline temperature when we're at rest, when we wake up in the morning, is lower before ovulation. And after ovulation, it increases usually about 1 degree Fahrenheit. So people who are sort of trying to get to know their menstrual cycle a little bit better will often measure their basal body temperature. And then there are just changes in our body that we notice, right? Like breast tenderness that develops after ovulation as a result of the ovary producing progesterone, changes in energy levels. Some people find they feel real super energetic in the first half of their cycle. And then after they ovulate, they kind of feel a bit more lower energy or like a little sleepy maybe in the afternoon. So there certainly are, other changes that can be subtle, but if you pay attention to your body, you can be aware of. So I hope that kind of explains
No,
and
definitely.
maybe a little bit more detail that you asked for, sort of the changes around that really important event, which is ovulation.
No, definitely. I think the more details, the better, because again, like now it's, for me, I'm shifting my brain between thinking like menstruation is not just about bleeding, it's whether you're ovulating. And I didn't know that sometimes even though you're bleeding, it doesn't necessarily mean that you're ovulating. So I think knowing the signs for yourself is super important, especially for someone looking to conceive, knowing the signs of their own body, when the timing is right to be able to have a successful pregnancy. So kind of leaning back towards PCOS symptoms and how it affects fertility. You mentioned before that PCOS is kind of that intertwine between insulin resistance, as well as we know that high levels of androgens kind of keep pushing those symptoms of PCOS to keep coming forward, which then delay those periods, making it more difficult for women to conceive. How is the impact of high insulin levels affect fertility?
A couple of different things happen. So in people with PCOS who don't ovulate regularly and have high androgen production coming either usually from the ovaries, sometimes from the adrenal glands, the high levels of androgens interfere with the sort of complex feedback that is occurring between the hormones that come from the brain and your ovaries. Because those androgens sort of remain high, this very precise loop that occurs, right? This interplay between the brain and the ovaries is interrupted. And so those high levels of androgens can interfere with the signals that tell the ovary to release the egg. How does insulin resistance factor into this? In two ways. Actually, maybe more than two ways, maybe three ways. Number one is probably the one that people are most familiar with. When you have insulin resistance that's not well managed, the pancreas puts out more insulin to address the excess sugar that your blood may be sensing. The insulin signals to the ovary to produce more androgens. So that is sort of the probably number one way. The second way, high levels of insulin tell the pituitary gland, which is in the brain. The pituitary gland produces these other hormones called FSH and LH. And in order for ovulation to occur, you need to have higher levels of FSH in the very beginning of the cycle, followed by a spike of LH, right? That's what sort of prepares the ovary to ovulate. Okay. But high levels of insulin actually tell this gland in your brain, the pituitary gland, to produce more LH. So there's sort of a higher amount of LH relative to FSH. And so that preparation of that follicle just doesn't occur. And that big spike of LH also does not occur because it's just sort of stable but high, right? Mm-hmm. And so this is another way that insulin resistance interferes with ovulation. And then lastly, in some people with PCOS, there's two types of cells in the ovary that produce hormones. The theca cells, THECA, and the other one is the granulosa cell. The theca cells are the ones that produce the androgens, the testosterone, and the granulosa cell is the one that produces the estrogen. And it appears that in some people, there is insulin resistance in the granulosa cell that sort of prevents it from doing what it's supposed to, which is taking that testosterone and turning it into estrogen. So that may be one of the mechanisms in some people that insulin resistance plays a role in this whole sort of interesting and beautiful system that is very cool to understand, but there are many different ways, like sort of places where things can go awry.
That's exactly what I was thinking when I was listening to you. Like, in a way, our bodies are so amazing because they're able to like constantly tell each other what to do to create this like balance and harmony within ourselves. But then it also shows like that it can, of course, lead to many other factors and problems, especially to complex conditions such as PCOS. One statistic that I found, it mentioned that like 70 to 80% of women with PCOS struggle with infertility. And kind of listening to throughout our talks and researching about PCOS, we know that insulin resistance plays such a big role. Kind of seeing those two connections, do you think that one way of being able to improve our fertility as well as PCOS is managing insulin resistance?
Probably the leading cause of infertility in PCOS is the failure to ovulate. If you don't ovulate, you can't get pregnant, right? You can't conceive. But if we can overcome that part of it, then conception is possible. And so it is possible, sometimes just through improving insulin resistance and other lifestyle changes, and sometimes, with the need of some medications to help with ovulation. And so a common cause, but it's one that can be overcome. And I think that's really important. In addition to the ovulation dysfunction, the insulin resistance and the elevated androgens also lead to chronic inflammation, low levels of chronic inflammation, and that can extend to the reproductive organs. And that may be another way or another sort of factor that leads to infertility as well. And also, if people have significant insulin resistance such that they have prediabetes or even type 2 diabetes, that can interfere with pregnancy and increase the risk of miscarriage. So there's sort of three different ways: the ovulation dysfunction, right? Or it's just sort of the difficulty in pinpointing when ovulation occurs, right? I would say that's the most challenging, because conception really can only occur in this sort of 5-day window around ovulation, usually 4 days before the day of ovulation and potentially the day after, and that's it. Yeah. But if every month your ovulation date is a little bit different, it's hard to know when to try, right? And so that can be complicated. But like I said, we have new tools now. We have new ovulation kits, types of ovulation kits that help people to pinpoint their ovulation better, which used to not be possible for people with polycystic ovarian syndrome. And also, we have medications that even if, you make all of your lifestyle changes and you're still not ovulating regularly, there are medications that can help with that. And so I want people to sort of appreciate the fact that they can, and if we can overcome that ovulatory dysfunction, then, you can overcome that the infertility that goes along with that. And then, by other lifestyle measures, sort of reducing low-level chronic inflammation and improving blood glucose should help with conception and also maintaining the pregnancy.
Right, absolutely. I think there's a lot of strategies out there in place to help women conceive, which is amazing. And I'm very curious to understand how, with glucose, we're able to improve our fertility. So you just mentioned briefly about it. Do you think then maybe not the solution, but one of the many solutions to being able to improve our fertility is by managing our blood sugar? Is that essentially a way to control our insulin and then hence improving our PCOS symptoms and fertility?
Yes. So maintaining stable blood glucose levels, which means sort of not over stimulating the pancreas. And there's many different strategies we use to do that. One is using the continuous glucose monitor, different dietary strategies, good sleep, exercise, stress management. These are all things that help to maintain blood sugar levels from not going too high, but also not going too low. That's a part that maybe sometimes we don't talk about enough. And, improving sort of that's called glycemic control in medical terms. Improving glycemic control or maintaining stable blood glucose is a big factor in overcoming the ovulation problems that can result in infertility and PCOS.
You mentioned about the CGM. So for those people who aren't familiar with that term, what is a CGM? How does it work? What is its role?
So a CGM stands for continuous glucose monitor. It's a small device that is applied to the skin, usually on the arm or maybe some other parts of the body, that helps to sense glucose levels in what's called their interstitial fluid. Interstitial fluid is the fluid that surrounds our cells. And the amount of glucose in our interstitial fluid should be almost equal to the glucose in our blood, right? So the levels should be about the same. And so with this very fine needle that doesn't even hurt, you barely feel it when you apply it, you can sense the concentration of glucose in this interstitial fluid. And knowing what that is allows you as an individual to learn what foods help to keep your blood sugar in healthy ranges, in what amount, at what times of the day in combination with other foods. And so it's a really great tool to learn about yourself, because nobody really needs the same thing. Everybody has individual needs. Everybody, different sizes, different activity levels, and different tolerances to carbohydrates. And so this is such an amazing tool to be able to learn about your own body and what you need. And that's a big part of the Aspect PCOS program, is using the CGM to personalize your nutrition and lifestyle to maintain healthy glucose levels.
Exactly. I think that's one of the coolest part about Aspect, the fact that everything's so personalized. So with the CGM, it monitors 24/7, and then all the health plans are based on your body's data, which is incredible. And I think a very new era to health. Of course, diet, exercise, as well as sleep and stress management also play such a big roles. What would you say, like giving one piece of advice for each one of those things should I start doing to be able to start improving my PCOS and improving my fertility?
Having well thought out meals that contain a small amount of carbohydrate for energy, and also with that adequate protein and adequate fiber and adequate healthy fats, essential fats, is really the key, right? But the amount of each is going to be what's individual. And so for you, your portion size may be different from somebody else. And the way you're going to learn what that is by using your continuous glucose monitor and adjusting. Second, sleep. Really, really important. Having good, consistent sleep habits where you try to get to sleep more or less at the same time, and that you try to get at least 7 to 8 hours of sleep, and is really, really important. Really making sure you get a good night's sleep that's pretty consistent regardless of what day of the week it is. And then as far as movement or exercise, it's going to be a combination of strength training to maintain your lean body mass, because the more lean muscle mass you have, that helps with your glycemic control, your blood sugar control, for many different reasons. In addition to some exercise where you get your heart rate up, because cardiovascular disease is something that people with PCOS are at risk for. So part of prevention is making sure that a few times out of the week, you do get your heart rate up. And then there's just what we call non-exercise movement throughout the day that should be increased. And so things like taking a walk for 10, 15 minutes for a meal, right? That's not really to get your heart rate up, or it's not really to, burn a significant amount of calories, but it does help to improve your blood glucose control, because it helps to allow glucose into your cells so that they can, your cells can use the glucose for energy. And then just if you sort of have a sedentary job, ensure that you get up for stretch breaks throughout the day, and so that you're not just seated for long periods of time. And so those are sort of the 3 different ways that movement can really help.
We've learned all the different ways how we can manage our blood sugar. We can use a CGM. We can also do this through lifestyle changes, but the CGM is really so crucial to be able to fine tune what kind of food we should be eating, what time, what portions, as well as what exercises work best for us, kind of see how all these different factors play a role. So by stabilizing our blood sugar, we can improve our PCOS symptoms and then regulate our periods to be able to have higher chances of conceiving. So we mentioned a little bit about Aspect's PCOS program before. I would love to kind of take 5 minutes to discuss it a little bit more in depth, especially hear your thoughts and opinions about it. So Aspect's PCOS program, they send you a CGM, so a continuous glucose monitor, which is great. We already discussed why it's so beneficial for managing PCOS and improving your fertility. But not only that, I think one of the best part about this program as well is the fact that they also pair you with a health coach. I think when I was wearing my continuous glucose monitor, I would have benefited so much if there was an expert by my side telling me, these are the range you should be looking at, or this food spiked it the most, but here's how you can change that to improve it. Try this exercise. And that's exactly what Aspect Health does. So you have an expert with you every single step of the way. And I think that's so crucial, especially for a woman looking to conceive. I think she needs help, and Aspect offers that in just a perfect little package. So if you're looking to conceive, then definitely check out the Aspect PCOS program. If you're struggling also with PCOS, it can definitely be the solution you're looking for. Dr. Basma, you being a PCOS expert yourself, what do you think about Aspect's approach and the benefit it can give to women with PCOS looking to conceive?
I would say there are three big benefits that I can see. Number one is the personalization. It gives you the tools to really come up with a plan that is unique to you. I don't really know that there are other solutions out there that do that. Whether, whatever your health goal is, right? Achieving pregnancy or not. Number two, the coaching that helps you to interpret things, because sometimes it can be challenging to see the patterns, and somebody who really can look from the outside and see what you're doing can help you to learn what it is, recognize the patterns that are making things better, making things worse, and sort of help you with setting goals and changing habits if you are struggling. Right. And then I'd say lastly, really is the health education, right? Yeah. There's so little reliable information out there about PCOS, and there is so much misinformation about PCOS and about metabolic health and about, glycemic control, especially on social media. And so it can be, and sometimes the information is conflicting, right?
Yeah.
Because sometimes people pose themselves as experts, and really they're just maybe an expert in themselves. Right. And so they're sort of translating their experience and sort of insinuating that it may be right for everybody, but everybody's different. And so where do you find good, reliable information? Aspect, I think, has really great health information that you can count on. And so, I would say for kind of those three reasons, Aspect is a program that I really haven't seen out there for people with PCOS. So I'm proud to be affiliated because I do think it's such a great company.
Definitely. I think we have the power to help so many women out there. So if Aspect Health sounds like something that you've been looking for, the solution that you deserve, then definitely take our free PCOS quiz. You will find the link in the description. It will be a quick, short quiz, and essentially you'll be able to see if the Aspect Health, the PCOS program, is a program that is the good, right fit for you, and it will just kind of give you a little bit more insight into how we can better serve you and your health goals. All right, looks like we're coming to an end on this video about fertility and PCOS. Dr. Basma, thank you so much for being able to be here with us and sharing your knowledge as a PCOS expert. I think many women out there looking to conceive and have PCOS are going to have so much benefit from the information you gave us today. So thank you so much.
You're welcome. My pleasure.
And again, link is in the description, and we'll see you in the next video.